So the CDC is reporting that osteoarthritis, what we call arthritis, affects approximately 32.5 million adults. Blows on skirt. Welcome everyone. That Barefoot Girl on spot. Thanks for joining me. How you do? Gosh, thank you so much. You know what? I've been thinking about arthritis because me notice say when me get up, me feel groan. You know them kind of Jamaican style groan we say, oh. And when since we started that. No, seriously speaking, osteoarthritis, it affects a lot of people across the world, and it's an age-related disease. Osteoarthritis is a musculoskeletal disorder, right? So it affects the joints, and it definitely affects the synovial joints. It could actually affect any joint, but it primarily kind of focuses on the spine, the knees, the hips, and definitely the hands. Yeah. So it's also progressive in nature. There's another name for it, degenerative joint disease. Some people call it that, DJD. Them actually call it a wear and tear condition, right, of the joints. So let's look at how the joints stay prior to the onset of osteoarthritis. When you're young and you can boom flick and you say you have double joint and you just a twist up and a carry on because you're a picnic. You're a child, so your joints them supple, everything intact, right? No pain, no issue. You don't even think about your joints when you're moving. What allows this is the natural and healthy condition of the joints. Right? You technically have the bone, so you have two bones, and this is the joint, right? But on each of the bones, at this point where they would form the joint, they have cartilage on it. So you know that kind of smooth, rubbery type of material. When you eat chicken foot or some kind of meat, you buck up on grizzle. Grizzle, what call it in Jamaica? Grizzle. Where does Z come from? But anyway, yeah, you buck up on grizzle, and that's the cartilage, right? So the grizzle is the cartilage, and it serves a purpose because that prevents bone on bone. And on top of it, there's another protector called the synovial fluid. So the synovial fluid is between the two bones. So it already have grizzle, right? Cartilage, right? But on top of that, we have the synovial fluid. And that's like a thick, sticky cushion between the bones. So that helps to bear weight and to prevent bone on bone. No issues because we have these two things going on. That's when everything is normal. Your better days in life, eh? Yes. But with the onset of arthritis, as we call it, DJD, osteoarthritis, with the onset of that, that's usually sometime around about age 45 or so. It could happen earlier, especially for people who are very active in terms of maybe professional sports. And let me tell you something, really appreciate on the athletes, And we love Jamaican athletes, but athletes across the world, they put out a lot of effort, man, and a lot of sacrifice because a lot of them have early onset of osteoarthritis because of so much wear and tear on the joints because of the type of activities that they're involved in long term. What is really happening with arthritis now is that Remember I tell you about the cartilage? All right. Cartilage becomes thinner. The gristle I get thin, drier, flaking, breaks off. So when that is going on, you can see how there can be a problem because we get into bone to bone. So you might say, what happened to the cushioning synovial fluid? But it started to get thin. And like I say, it's progressive. So it gets thinner and thinner, so less cushion. You know, when you have one cushion and you've been sitting on it, you have it in the car because you may not know your seat can't ice up, but you're sitting on it in the car, and this cushion just gets flatter and flatter and flatter and flatter. After a while, you need a new cushion, right? It's not doing its job anymore. So it's the same thing. Synovial fluid is now thin out, can support pressure and all of that. So guess what? Both things now are working against us. So hence, a lot of people end up with bone on bone. And there are some other little things that goes on because with the bone itself, you start to have some little cysts, like some little pockets, some little holes with fluids in them in the bone, right? That wasn't there before. And also, if you notice, a lot of people with arthritis, as they get older, you start to see some deformity. Sometimes in their stance, there's a curvature or a twisting. Sometimes the knees just kind of turn away, but definitely you'll usually see it in the hands where the fingers, if you look, you'll see some deformity. Like you might see some like nodules up here, some little bumps, like, right? Calcification and those things cause that. What is happening in the joint is that because now it's dried, the cartilage is gone, there is some what they call osteophytes, and it's like some pieces of bone start to grow out. So that's not normal. So it gives some deformity to that joint. Hence, we see some of the older folks who have arthritis for a time, the finger, they shape some different way in the joints and all of that. But this is where you see the results of calcification and bone deformity in osteoarthritis. So you can imagine pain. So some of the effects included pain, like we talked about, and the deformity. But did you know that one of the side effects of osteoarthritis is weather telling? Yeah, man, you can forecast the weather. If you're Jamaican, you know what I'm talking about. And I think it happens to people outside of Jamaica as well, but for sure we know. I know you know somebody in Jamaica with arthritis who can tell you when rain will fall. And you say, no, but the sun is shine, or you know. And them say, the need, man, the need them a bother me. Arthritis. And me tell you, say, 99% of the time them right. So it's a thing. They can tell the weather off the record. On a serious note, from the deformity and all of that, you find that people sometimes have a weaker grip. And then when you consider the hips and the knees, you're talking about mobility, right? Their ability to move freely is hindered because things are normal no more like how it used to be. The pain is involved, so that alone can make you not want to move, you know. Pain can make you don't want to move because you realize that when you move, it hurt, right? But then the way in which you move too, because you could be, your pain site might be, say, the left hip because of osteoarthritis, right? And you kind of move around in a protective way. You don't want to do too much on this side or with this side. So you end up walking a certain kind of way. Before you know it, after a while, you're kind of walking lopsided. So pain and immobility, the inability to move as you would normally do, are two of the primary effects. So how do you treat it? Well, first of all, you have to get a diagnosis, right? Your HCP will come up with a diagnosis based on what you tell them that you're experiencing. They don't necessarily need an x-ray to give you a diagnosis, but the x-ray can confirm it, you know, what there's the clinical signs and what you're reporting. So, but pain is a biggie, and so they'll have to address that, right? And they'll probably start you on something topical a rub, one of them NSAID. Because number one, with the older population, as a provider, you still have to be mindful of what's going on with that person and the age factor. And because of the age factor, some stuff might be going on in their body or might not be working up to par, say their kidney, and you have to think about a lot of things. So they'll usually, on the side of caution, start you off slow and probably with a topical rub, and then after that probably progress to an oral NSAID. But then make sure you eat when you go take your NSAIDs. I talk about like ibuprofen and them things there. Eat, put something on your stomach. And two, it would be nice if your healthcare provider prescribe you something for your stomach, like pantoprazole or something like that. But eat some before you take the medicine there, if they do put you on oral stuff. But there are some rubs and different things. Just talk to your primary care, talk to your healthcare provider, because they have to, I'm giving you some tips and some information. No, but they have to look at you as an individual and everything that's going on with you in order for you guys to come up with a plan and decide on what would probably work better for you and your situation, right? All right. It's not one blanket throw over everybody. No, healthcare is individualized. First of all, we have to talk about the causes. There are some causes that, are risk factors, we should say, that you have no control over, like aging. You don't have control over that. Genetics play a role. If you have close family members with osteoarthritis or arthritis, that's a risk factor as well. Being female, so the unmodifiable ones we can't do nothing about. So let's talk about the modifiable ones. Suppose you're somebody who's super active and you're doing this and you're doing all kind of things and stuff. The arthritis, it kind of comes on at a little later age. So maybe you would have done run up and down already and know I feel the after effect. But in general, this is something that you can control, right? Let's say, for instance, me now, perfect example. I was exercising. I was just doing my morning exercise, and I realized, no, I know from a long time, so I need them not too wonderful, right? So when the lady, when I watch and she do her thing, and she talk about jump on knee and I jump on a knee, I not do that part there. Me improvise and do something else. Because me can feel it. So when me improvise, me know so the next thing still I make me move, but me not feel a pain in my knee. So me not rub out my knee, because all me sitting in my head is cartilages are wear down, right? And me don't want that happen too fast, if it happen any at all. So me not about to jump like how she said jump. Me just improvise and do some other things. So that's something that you can do, right? Choose the kind of exercises that you do, because you still want to move, because a movement tend to aggravate this disease process. You kind of want to decide and make up your mind and kind of research and find out what kind of exercises not gonna be too rough for your joints. Say walking, or say water aerobics, like that. Things like that. Remember the joint, because when it now come back, you're going to need knee replacement or hip replacement and all them lovely things there. So if you can avoid it, try. So that's one of the things. You can modify your exercise routine and your activity so that you don't put too much pressure on the joints, because this is the problem there. Another thing is, because one of the risk factor is obesity, you have to go lose some weight. Yes, because it put a whole heap of weight on the knee joint. Yeah, just, a ABC that you can see that. You know that too. Sometimes I know you say it. But no, you have to be very vigilant about losing this weight. And for the most part, weight loss is not the whole part exercise. The exercise is excellent, but the exercise is not really the thing that make you lose so much weight. It's cutting your carbs, eat smaller portions, and choose what you eat, right? Choose what you eat. Start get smart about what you put in your mouth, right? All right, and how late you eat. And mind you, there are factors that can make you put on a lot of weight and you not even eat a lot, There are some people that happens to. So that's a separate case. But for the most part, we can control our weight gain and our weight loss. So let's work at it, because the pressure or the weight on the joints, especially your hip and your knees, whoa, I've seen people suffer because of that. And a lot of times they suffer for a long time because nobody wants to go to surgery. No, it's not something we get up and say, oh, I want to go and do knee surgery. No. So people suffer in pain for years even. Going upstairs is like, oh, I've seen it. And then eventually they decide that, you know what, I have to go do the knee replacement. And then afterward, them fine, man. Them have them bionic knee and them good. But still, you don't want to go through that, because not everybody come out of surgery and regain top-notch mobility and all of that. Some people end up gaining a lot of weight after surgery, and I don't know if they didn't follow up with the physical therapy as per the plan of care, but you don't want to take your chances like that unless you absolutely have to. Research foods that have anti-inflammatory agents in them. Even though osteoarthritis is not primarily an inflammatory condition, you still want to choose foods that are good for treating inflammation. Say salmon, that has high level of omega-3, right? Good for you. Eat your nuts. Watch your portions. You know, say at the same all time something where everybody has told from a long time. Moderation, fruits and vegetable, and a whole heap of grease, and all those things. And then something I'm telling you, So you can eat your fish if you eat meat, right? When we say meat, we mean if you eat deaders. Yeah. Jamaicans, you know what I'm talking about. So if you do eat meat, you choose. And if not, find out what foods carry the vitamins and nutrients that you need that are beneficial to your joints. But it's a big difference. It's a big difference. You look on the baby just crawling around, boom, 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 on them knee, boom, 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 and run and, crawl and then sit down and laugh. Not a pain them I feel. Excellent cushion, everything brand new. Synovial fluid, flushy, protection and everything. But then it wears throughout the years. But do your best to take care of your joints now, because we need them so that we can be mobile, so that we can stretch and we can reach for that, and we can, sometimes even a simple task as buttoning up your shirt is so challenging to a lot of our elders. Yeah man, it can be debilitating. So and then something depressing, when you realize you catch your age, and what happened to you, you can't even button up your shirt. If this is what is going on in your body, hold your head up and fight it day by day. Do your little exercises, eat well, take your medicines as order, and if you're taking an NSAID, please put something on your stomach, eat something. Alright, thank you for joining me again, guys, and remember, share up the thing. See you next time.